At Lambeau Field aimed at raising awareness about sleep apnea. Dr. Mark Reinke joins me now live with more on the event. Doctor, thank you for joining us, and maybe you can start out with talking about what is sleep apnea.
Good morning, Pete. Sleep apnea is a very undiagnosed condition in the American public and the world for that matter. Basically, sleep apnea or obstructive sleep apnea is stopping breathing while you're sleeping. It's usually due to the anatomy of the throat, usually the base of the tongue in adults. But that's one of the big things that we'll be talking about here today at the sleep conference and tonight.
Yeah. Tell us a little bit about the conference. When does it start, and can anybody go?
The conference tonight is open to the general public. It's at 6 o'clock. It's at Lambeau Field, where we are right now. There'll be a presentation by myself, Dr. James Ryder of Cardiology Associates, and also Aaron Taylor of the Packers.
Doctor, how do you know if you have sleep apnea? I mean, does your husband or wife know it quicker than you do?
Typically, yes, Pete. Usually the wife will bring the husband or significant other into our office, and they will remark that they're stopping breathing, they're snoring loudly, and they feel as though they're not getting a good night's sleep or fatigued. And
this is something you shouldn't really mess around with, right? I mean, you should take your mate's suggestion about going to the doctor, right?
Well, we do recommend that. There's lots of complications from untreated sleep apnea. Some of those complications can be increased risk of heart attack, stroke, diabetes, weight gain, depression, and those can be readily taken care of or improved with treatment for obstructive sleep apnea.
Yeah, and I know you're going to go into that a lot tonight, but what are some of the treatments for sleep apnea?
There's many different treatments. There's everything from a CPAP machine, continuous positive airway pressure. There are dental appliances. There's upper airway surgery. There's weight loss plays a role as well. So that's one of the things that we do in our practice is we educate the patient as far as treatment options and give them the option and the decision making for that.
Very good. Well, Doctor, thank you very much for filling us in. And once again, that whole event is later on today at Lambeau Field Atrium, right?
That is correct, 6 o'clock. Thank you, Pete.
Thank you.